Welcome to the Jack Westin MCAT Podcast with your host, Phil Hawkins.
And Azaii Calderón Muñiz.
Welcome to yet another episode of Subjectively, my favorite podcast. So today we're going to talk about bones. So I don't know about you guys, but it's something that I really struggled with learning about, both while studying for the MCAT, but honestly, while in med school too. There's just so much going on. And our goal today is just going to be to simplify that for you because bones are hard.
I'm kind of with you. I feel like bones are one of those topics that I feel like everyone understands bones to some degree, right? Like if I talk to a high schooler and ask you, like, what can you tell me more about bones? What's going on with your skeletal system or endocrinology? The answer is always skeletal system. Because I feel like a lot of stuff just kind of makes sense, but there's a lot of other stuff going on with bones that I think students don't realize or people don't realize. Everyone kind of understands the skeleton for like moving around and structural things like that. But there's also huge roles in immunology. There's also huge roles in like cardiorespiratory. There's huge roles in even the activity levels of your neurons and the activity levels of your muscles and like DNA replication. And all of these things are tied somehow to your bones. And so if your bones disappeared, all of a sudden your DNA can't replicate as well as it used to. And that's not just in your bones, but everywhere in your body. And so understanding this is kind of a big deal and a little bit more complex than I think students initially, kind of think about when it comes to bone stuff overall.
100%. And I think it's this, intimate tie with so many other, components of how our body is regulated that's really helpful to understand. And also having that solid understanding, of the mechanisms of the skeletal system and really more granular at the level of bones makes it easier for us to understand as future physicians why we'll make some of the recommendations we'll make to patients. And so having that strong foundation helps us build upon what we're ultimately going to be doing someday.
Yeah. So we're going to start off talking about just kind of like the classic stuff that everyone kind of knows about bones, but is still important and still testable. And that's like the structural side of things, right? Like your muscles in your body are not going to do anything if they don't have bones to pull on. And we have like our elbow and our shoulders, all of our hinges in our body, our joints, and allowing them to kind of like move around requires bones and muscles kind of like working in conjunction. I do want to take a second here and just throw out, when you're taking the MCAT, this is a very prime place for the MCAT to connect physics and torque and forces and things like that. And so you need to have a really good understanding of those things because when the MCAT tests torque, I think probably the easiest way for them to test that is with biomechanics of bones moving and the muscles kind of pulling on the different bones in your body. And so you definitely want to understand that. There's also how we build and break down bones, which we are going to talk about a little bit more as we go forward. But we have kind of two main things. We have our osteoclasts and our osteoblasts. I always remember that the blasts are builders and osteoclasts are tearing things down. Kind of like catabolic versus anabolic. I know this is not technically related to bones, although it building and breaking down bones are catabolic and anabolic processes. I should clarify. Anabolic means to build things. Catabolic means to tear things down. And so I always just think C means to tear things down. So catabolic, osteoclasts. And so those are things that are kind of breaking down stuff. Actually, osteoclast activity is a catabolic process. Another way to remember that is anabolic steroids. That's how we people would take anabolic steroids to build a bunch of muscle because anabolic means building. Catabolic means breaking down.
Yeah, I always remember it as same as you with the osteoblast. So they build and osteoclast consume. And so consume for calcium. It just helps me remember, what they're doing and also why they're doing it. And then there are also the osteocytes, which kind of make up the bone itself, right? So we think about the osteoclasts and the osteoblasts regulating the like the bone structure, but you also need to have the bone structure itself. And so just a couple of ways to remember that. Osteocytes sit, right? they sit in the bone is the way I like to think about it. And like you were saying, Phil, the MCAT can absolutely test you on, in the physics section with bones, right? And like you were saying, part of that is torque, part of that is forces. And you really need to understand the way forces act on bones in medicine. And again, students are always asking us, am I actually going to use this when I get to medical school and I become a physician? Because it's so easy to see these things kind of in a bubble. And okay, why do I really need to know this? But you have bone breaks, right? Your bones break, you get fractures. And so understanding the forces that are acting on the bone can help you understand the type of fracture to look for, right? On x-rays, if you're a radiologist, you'll definitely be looking at this, right? And honestly, every other physician will also look at the radiographs. I don't know a single doctor who will get imaging in and never looks at it. And so having that understanding helps you say, okay, what bones might also be more likely to have a fracture, right? So a thinner bone more likely to get a fracture than something like, the bone in your arms, right? And so thinking about like the humerus, the femur, those bones are going to be a little tougher to break. And so when you have these longer, thicker bones, you don't expect the breaks, right? So this is a place where as future physicians, you'll actually have the opportunity to intervene and might be one of the first people to observe something like child abuse, right? Because you'll see these fractures in these thick, long bones and you're saying that doesn't make sense, right? The child isn't walking or it was a simple fall and something else should have fractured, not this bone. And so that's something where, again, radiologists would care about this. Family physicians are going to care about this. Pediatricians will definitely care about this. But these aren't the only folks, right? Also, OB-GYN, when you're delivering babies, you need to understand kind of the mechanics of what's going on, right? Maybe the shoulder gets stuck and you have to maneuver the baby or the infant in such a way that you can actually get them out safely. And that won't always happen. And sometimes you'll fracture the clavicle, right? So up here, this bone, you're going to do something different in adults versus kids. And for that, you have to understand how the bones in children are different from the bones in adults, right? The bones in children are still growing. They have a greater capacity for regeneration. And so you're going to care about all of these things as a physician. And then perhaps my favorite, orthopedic surgery. So story time, and I'll try and make it quick because I've been talking for a little bit. So earlier this year, I was on orthopedic surgery and I got the opportunity to do some really cool things. And so one thing that is important with bones, right, with the spine, is that you have to pad the space between the vertebrae, right? The bones, those smaller bones in your back. Why? You don't want bone on bone, right? And you need to be able to move and bend your spine back and forth. And so we have what are called discs in between the vertebrae, in between these bones that protect your spinal cord. And so sometimes these discs, they flatten, they kind of move into the space of the spinal cord. They do things they're not supposed to do. And one of the things that can happen is that they can put pressure on the nerves. Same with the spine. If the bone grows in such a way that it's putting pressure on the nerves, you got to do something about it because people are going to be in pain. So one of the things that they can do is they can take out the disc, right, and then put in a metal plate with bone matrix, with bone cells, with actually essentially like bone dust, which is really cool. And that's going to grow, right? And it's going to put that space and allow that space between the vertebrae, between the bone. And so once you put those in, though, you have to make sure they're going to stick, right? You don't want those coming out and ending up in a different part of the body. And so one of the things that you do is you put in a metal plate and you just drill the metal plate in so that you have that stability. So like I said, earlier this year, I actually had a really cool opportunity to essentially drill into someone's neck while, doing this, setting up the plate, making sure that they're not going to have continued pain. And the really cool thing about these surgeries is these folks get pain relief right after surgery.
Immediately.
Exactly. And so understanding, right, the capacity of bone to regenerate, the physics of having space between the bones, and how these discs, right, can allow for movement of the spine. All of these things are important, and they play such a huge role in understanding why you're doing certain surgeries, right? And just the really cool aspect of actually doing the surgeries.
Yeah. I feel like surgery is one of those rare fields of medicine where you can go to work every day and then like you can immediately see like huge changes in quality of life for patients. Things like that, like back surgeries, but also there's somebody I worked with who did a lot of cornea replacements and like just people going from blind to being able to see, like all of a sudden overnight is like so powerful. I feel like maybe why some surgeons get a God complex. It's like, I am healing everyone. And like, it's just like super obvious. And you don't always get that as often, not on like a daily basis in like pediatrics or like family medicine or things like that, where it's like, there's a problem and now they're cured just overnight. But yeah, it's something that is very interesting kind of overall. Just to kind of touch on the bone breaking thing, I have students all the time come up and ask me, like, as I'm tutoring and teaching stuff for the MCAT, like students asking, like, why do I need to know like electromagnetism? I'm like, well, if you're a radiologist, you definitely need to know this, right? Why do I need to know fluid dynamics? Well, if you're a cardiologist, it's like critical. Like you really got to understand how fluids move if you're a cardiologist. But I also often hear this stuff with like, torque and like this sort of like motion things and like bones breaking and osteopedic surgery and those sorts of things always come to mind. It's really important because also this is kind of where violence comes in and like dealing with stuff, kind of like you said earlier with abuse. You may be able to kind of like look at an x-ray and know that like, okay, there's something wrong here. Like that should be really hard to break. There are other places that might be a little bit easier to break, but when you're getting the story, maybe the story doesn't match up. So if you understand torque, you understand grabbing somebody's ankle and pulling on it is going to generate twice as much like torque, that like sort of rotational force, as grabbing someone in the middle of the shin. And so if somebody's got a broken tibia, and the story is somebody grabbed them by the shin and like twisted their ankle or something, you're like, okay, wait, that doesn't make sense with the break that I'm seeing. Like you wouldn't be able to generate enough force for that. And so all of a sudden, just kind of like matching up your understanding of torque and your understanding of forces, you can realize like, okay, I don't think I'm getting the full story here. People are like, there's something kind of like going on. And you know what? Maybe they are telling you the whole story, but maybe there's something wrong with the bones themselves. Like maybe the bones are weaker or things like that. Either way, your understanding of torque can help you, figure out if someone's got a degenerative bone disease, or if some abuse is going on there. And like, that's why it's important to make sure that you understand these things, because it's absolutely critical for you to understand those in some fields of medicine. To be honest, if you're a pathologist, it's probably not that important. But but if you go into like emergency medicine or all the fields you mentioned, family medicine, peds, like orthopedic surgery, all of those, absolutely, you got to have a good understanding of those. So, that's kind of like, we kind of preface this by saying these are the things that like kind of everyone has a good idea of, like bones help you move and they like protect your lungs and heart and stuff with your rib cage. But there's a lot of other stuff going on with bones. And so now we're going to talk about what's inside bones, because bones are not all solid all the way through. Some bones have red bone marrow in them. There's a couple different types of bone marrow. There's yellow bone marrow, which is mostly fat adipose tissue. But some bones have red bone marrow, and they're red because of all the red blood cells. And it's not that red blood cells congregate there, it's that red blood cells are made there. So actually all of the blood in your body, all the blood cells, both the red blood cells and the white blood cells, your immune system, all of those are technically coming from bone. And so it's kind of a weird thing. This kind of like makes everyone scratch their head the first time they read this, but bone, like blood cells, are connective tissue, because your bone is connective tissue and your blood cells are made from your bone. And so looking at like tissue types, that's kind of an important thing. And so if somebody has like cancer where they're making a lot of like the wrong kind of blood cells, that's actually kind of a bone cancer, right? It's a cancer that's occurring in that red bone marrow where like cells are growing and dividing, like certain type of like neutrophils or like eosinophils or basophils or something like that. They're growing when they shouldn't. And so it's actually kind of an interesting thing. Like if somebody has that bone, like that blood cancer, you will like use radiation to just kill all the bone marrow. Like you'll use like basically, what UV rays do to our skin to like kill skin cells and cause sunburns. You just do it at like a higher level and you like use radiation or light to kill the bone marrow. And then you transplant that from somebody else. And so you take the bone marrow out of one person and you stick it in the other person. And so let's say you took the bone marrow from A and put it in bone marrow B. This is something that like always like seems like the coolest thing to me is technically the blood from the person who got the bone marrow transplant, their blood cells don't have their DNA. My blood cells are going to be made from the bone marrow that I just got from somebody else, from person A. And so even though I'm person B, if I like spilled blood at a crime scene or something and they like tried to sequence my DNA, it wouldn't be my DNA. It would be somebody else's DNA because I got a transplant from somebody else. And so that's kind of an interesting thing overall. And those bone marrow transplants, they used to really suck. Because to get the bone marrow out of the bone, they'd have to like drill into your bone and take this giant syringe and suck it out. And like, it's evidently very painful. But nowadays they don't have to do that as much because we figured out like we understand stem cells better. And so a lot of times they can just take a blood sample and take stem cells that have made it into the blood and be able to basically recreate bone marrow without actually having to drill into bone. Just a side note, I think everyone should register in a bone marrow registry because it can be as simple as like getting your blood drawn to save somebody's life. They don't have to drill into your bones anymore. There's a good chance that you can just donate blood and they'll be able to create bone marrow to save someone's life. And so I always encourage people to register in bone marrow registries because that's one of those things where you can like basically save somebody from cancer by donating blood.
So I'll come back to that idea in a second, but this is where pathologists can be useful.
Yes, absolutely.
Basically every part of the medical profession in terms of physicians can actually be connected back to bone one way or another. And again, this is really cool because even just looking at someone's blood draw, right, their complete blood count, you'll hear it called a CBC. It's going to look at your red blood cells. It's going to look at your white blood cells. It's going to look at your platelets. And so if you see that some of these cell lines are down, it's going to prompt you to think, okay, is something wrong with, the bones? If you see all three down, you got to be concerned. What is happening in the bones, right?
Mm-hmm.
If you see one line that's gone through the roof, you're thinking, something's a little off, right? I need to think about what's going on in the bones. And so much of what, gets done on a day-to-day basis in medicine is actually assessing not just, the cells themselves, but also the health of the bone, right? Mm-hmm. And so it's really incredible the way all of these things are connected. And it's funny that you mentioned the bone marrow registry. So the first time that I kind of started really thinking about bones in a way other than, okay, it's protecting my heart, my lungs, right? My spleen, my liver, it helps me move, was actually in undergrad, where I actually signed up for the bone marrow registry. And part of the reason I did that is there were just some folks on campus and they were telling me a bit about how minorities are very underrepresented in the bone marrow registry. And part of this is not knowing about it. Part of it is fear. Part of it is just misunderstanding in general. And so what happens is someone who is Latinx or Indigenous or Black African American is going to have a smaller chance of finding a match. And so they're more likely to, if they develop a bone, a blood cancer, not get that bone marrow transplant. And I remember when I told my parents I was going to sign up, they're like, are you crazy? Why would you let someone take your blood? What if they have to drill into you? Right. And so like you were saying, the really cool thing is that more often than not, they'll do this peripheral blood stem cell collection. That's what I actually had done. So they ended up contacting me pretty quickly, and I actually got some injections, and you actually feel these cells growing in your bones because you get bone pain. And so it's transient. Y'all will be fine if you end up getting called. It's not, it's very doable, and you can handle it fairly easily. But that's just the amazing part of the human body, where you can feel it doing what it's supposed to do in response to these medications and in general. And so it's quite the experience. So I agree. If it's something that you can at least consider signing up for the bone marrow registry. I still have my jacket that has the date that I donated, and every so often I'll wear it, and it just makes me really happy.
That's so, I actually didn't know that about you, Azaii, and that's really weird that kind of like, I was kind of like pushing bone marrow registry so hard, but you're absolutely right. That's awesome. That's really exciting. Just kind of overall, I don't think I've met anyone who's done a peripheral stem cell donation, but that's awesome.
Yeah. And it depends on, why they need the stem cells and what else, is going on in the factors into the person whose, I guess, life you're going to be saving. But yeah, it's definitely something to consider. I recommend that folks sign up and just look into it, help dispel some of those myths and concerns, because there are a lot of things that we can do in medicine to help other people even before we become physicians. And so that's just one other way.
I feel like we should throw like a bone marrow registry thing in the description of this video. So just in case you guys are interested, clicking on that is probably a good idea.
Yeah. And actually, really cool thing is when you sign up, you don't get blood drawn yet. You just actually do a cheek swab. So it's very easy to do.
Yeah.
So like we were saying, the bones respond to a lot of things, right? And so, yes, they can respond to a stem cell, medication promoting stem cell growth, right? And multiplication. But it also has a really important tie with the endocrine system in general, right? So everything from calcium to phosphate to vitamin D are all playing an integral part in your bone health, right? And so one of the most important things that your bones are going to help regulate in terms of, and that your endocrine system will help regulate via your bones, is calcium, right? And so you've seen calcium in neurons and allowing calcium to, or using calcium to release neurotransmitters into the synaptic cleft, right? You've seen calcium in muscle contraction. And if you haven't already, now's a good chance to go and look at muscle contraction after this video. And phosphate, like you were saying, Phil, that's involved in DNA synthesis, right? And phosphorylating proteins. And these are all things that our body does, probably millions of times on an everyday basis. And so having these levels regulated is so, so important. Right. And it's really important to think about the endocrine system in general. And a lot, again, like you were saying, a lot of folks are like, why do I need to know about calcium in the blood? This is why, right? Mm-hmm. Why do I need to know about sodium in the blood? It's just some random number. No, the same way that you need to know about, calcium and phosphate, you also need to know about levels of other ions like potassium, chloride, sodium, protons. And so we're not going to talk about that in this video, but the kidney is actually a huge regulator of all of these, right? Mm-hmm. And so it's a little tough to just verbally explain, but we strongly recommend that you go, again, this is something else, additional homework after this video, to go look at how the kidney regulates these ions and the levels of these in your blood. These are really important things to know. And I've seen quite a few questions on the MCAT test this, and I'm pretty sure I had a question on that on my test day.
Yeah, this is a big thing. So just kind of like thinking about this other stuff that bone does. I actually recently went hiking in the mountains. I have a brother who lives in Denver, or near Denver. And I was visiting him and went to Rocky Mountain National Park. And we went up and I was like hiking, and I'm from the lowlands. I'm from like basically sea level. And I went up there and I was having like a hard time hiking, where I would like walk, like I would increase in elevation, like 20, 30 feet. And I'm like, all right, I got to pause and breathe because I'm just having a hard time because there's not as much oxygen at, high elevations. And so one of my things that my bones can do, like if I lived in Denver, they would increase the rate of red blood cell production. And so I would have more red blood cells. So my blood would be better at carrying oxygen. And so this ability to kind of adapt to the different environments. You can also like start to produce more of a specific white blood cell. Like if you have a parasite infection, your body will just make more eosinophils. Often you can make some conjectures about like if somebody comes in and they're sick and you test their blood and you realize they're high in something, like you might be just seeing the body responding to whatever the issue is. Like maybe it's a viral thing and like you have a lot more like natural killer cells or cytotoxic T cells, or maybe they have a bacterial thing, they have high neutrophils, or maybe it's a parasite, they have high eosinophils. And so you can figure out a lot from this stuff as well. But kind of coming to the calcium and phosphate thing, I actually think this might be, in my mind, one of the most important things that bones do, right? I feel like the other stuff is important, obviously, right? Like being able to make red blood cells and immune stuff and structural things. But your levels of salts, like calcium and phosphate and sodium and potassium, need to be so tightly regulated. If you have too much calcium, your muscles and your neurons will fire too quickly or too easily. And so you'll start to have like seizures and things like that. If you have too low calcium, they won't fire at all, which means your neurons will quit firing and your heart will quit beating. And like, that means you're dead. And so these things being off just a little bit can have like fatal results. And so one of the big jobs of bone is just storage of calcium and phosphate. So like if you look at the bone at like a microscopic level, you have like collagen fibers kind of running through it. And then you just deposit, it's called hydroxyapatite, which is just a calcium phosphate crystal, basically. So your bones are made of crystal, which is kind of cool. But as you need more calcium, you'll take the calcium off of the bone. If you have too much calcium, you'll put the calcium onto the bone. And so you'll be building and breaking down bone constantly just in response to what's going on in your body. And that's why if you like drink milk or something that has more calcium, you will have stronger bones because there's more calcium in your blood than you need. And so you'll deposit that calcium, essentially storing it for later if we need calcium. And so I kind of think about bones as like big warehouses of just like storage for calcium and phosphate, just waiting until we need it. Obviously, phosphates we need for building DNA, but also RNA. So like making messenger RNA and stuff like that. ATP, that's got 3 phosphates on it. So in order to make ATP, we need phosphates. In order to activate or deactivate proteins, often you'll phosphorylate them. And so our phosphate levels need to be really tightly controlled as well. It also kind of comes from that overall. I feel like that's one of the great things about science. Maybe this is just me getting super excited about this, but like I feel like the farther I go in science, the more you start to realize everything is connected, right? So like me hiking at elevation, that's a bone thing, right? Like me drinking milk and having stronger bones, that's obviously a bone thing, but like just kind of like being able to like adjust and adapt to all of these things. Now, one of the main ways that we control this, like at a hormone level, endocrine level, is through your thyroid and your parathyroid. And these are things that the MCAT will test a ton. And so your thyroid releases calcitonin. And so calcitonin tells your body to build more bone. Parathyroid hormone is released by the parathyroid. Who would have figured? And that makes you break down bone. So parathyroid hormone will stimulate the osteoclasts and inhibit the osteoblasts. The thyroid hormone will stimulate osteoblasts and inhibit osteoclasts. And so it's like really confusing, like trying to put those things together. You got to be really careful. I always just remember that as you get older, your thyroid kind of gets weaker generally as you get older. And there's a lot more stuff going on here than this example. This is just how I remember it. Like as you get older, also like your thyroid's responsible for metabolism. So your metabolism drops. but also your ability to build bone drops as you get older. And so like, it isn't just the thyroid that's controlling this. And there's a lot of other factors in here, but I just remember that as you get older, your metabolism drops and your bones get weaker. And so your thyroid getting smaller or shrinking or becoming less effective can kind of explain both of those. And so I just link those two together. Thyroid helps me build bones. And so as I get older, that gets worse. And so I don't build bones as well. But there's a lot of other hormones involved in this and a lot of other processes involved in this as well. But you definitely want to make sure you know the difference between calcitonin and parathyroid hormone. And you need to know exactly what they do, because that's something that the MCAT tests often. Just as a side note, if you ever get a question and one of those is the correct answer, the other one will be an answer choice. And so like they know students get them confused and flipped around. So you got to be crystal clear on which one is which. So just to clarify, calcitonin builds, parathyroid tears down bone.
And again, to make sure everyone's clear, right? Parathyroid hormone from the, parathyroid, calcitonin from the thyroid, right? So keep those separate. What's really interesting is when folks get their thyroid removed or a thyroidectomy, right? Ectomy, just take it out. They actually sometimes, right? Well, not sometimes, but they'll have lost their ability to produce calcitonin. And what's really cool is it doesn't wildly throw their calcium out of whack, right? Because if it did that, people with, who've had their thyroid removed would have a lot of issues. Yeah. And so what's really cool is that suggests that the parathyroid hormone plays a bigger role in calcium, the maintenance of appropriate calcium levels in the blood than calcitonin. So just a really cool fun fact. Now, other things to think about, because this was something that I struggled with. I was like, okay, so is it just the bone that's involved in calcium levels? And what's really cool is that the parathyroid hormone will also tell your kidneys, hey, don't lose that calcium, right? I need it. And so that's another way that the parathyroid hormone affects calcium levels in the blood. And also it's going to do it at the level of your gut, right? You need to absorb more calcium. And so what's really cool is vitamin D will help enhance that calcium reabsorption in addition to the release of parathyroid hormone. Now, I don't know about you guys, but you pick up, a gallon of milk and it's going to say, with vitamin D. Right. And that's part of the reason your body can really only absorb about, last time I checked, it was like 10 to 15% of dietary calcium on its own. But with vitamin D, that goes up to like 30%. Right. Still not amazing numbers, but enough that it makes a difference. And so as folks age, this is one of the reasons that we tell them, hey, vitamin D with a calcium supplement. This is why, part of the reason why in children, in newborns, if they live up here in Boston, they're getting a vitamin D supplement, right? And also depending on their diet. And so this is where it's really interesting, right? Where diet plays a role in bone strength. And so we just said vitamin D is important with calcium, right? To help that calcium get absorbed and get deposited, right? And let the osteoblasts build bone. And so for kids that are fed goat's milk or almond milk or soy milk instead of cow's milk, they're often not getting enough vitamin D. And so this is why these kids, it's really important to give them supplements, because otherwise you don't have a lot of vitamin D, your bones aren't going to be as strong, right? Even if you're getting the calcium, they're still going to be weaker. And so one of the ways that this manifests is actually in children, rickets. And so rickets is essentially just not having enough vitamin D, right? And your bones aren't as strong, they're weaker, and then you get fractures. And so this is something that is really important to identify. So when you're talking to parents about the nutrients that their children are, consuming, or you talk to adults, right? The adult version of rickets being osteomalacia. But you have to also think about, okay, why am I suggesting this? Why am I prescribing this? And it's to maintain that appropriate, balance of calcium and bone strength, right? And then coming back to this idea of the thyroid and parathyroid and namely parathyroid hormone. So there's an illness called DeGeorge syndrome. And in this case, people can be born without a thymus. Now I said thymus, not thyroid. And so the thymus, right, you've heard us talk about it before, T cell production, really important in childhood, not so much as an adult. What we often don't know, and this was surprising to me, is that the parathyroid is kind of built along with the thymus during embryology. And so these folks are going to have less parathyroid hormone. And so remember, we said parathyroid hormone controls calcium levels in the blood, more important in a stronger way than calcitonin. So if parathyroid hormone increases the level of calcium in the blood, if you don't have it, what do you expect to happen? Right?
Low
calcium levels, exactly. Calcium levels drop. And so these kids have hypocalcemia. And so all of these things are so intimately tied. And you're going to use this, whether you realize it or not, when you're practicing medicine. You've heard me talk a lot about peds. I've had peds on my mind, but it's really important to understand why, the mechanism for why some of these things happen. And, that's why we tell older adults as they're aging, right? Vitamin D, calcium. We also tell them to strength train.
Mm-hmm. Yeah. So strength training is like a really interesting thing. So it turns out your bones, like that role of like structural thing of like helping you walk and move around, like that also responds to your environment, just like everything else we've talked about, like the immune system, the calcium stuff, all of that. And so it turns out that when people exercise or lift heavy weights, your bones get stronger to be able to deal with that. And so you'll deposit more calcium, you'll deposit more like hydroxyapatite crystals, which also have phosphate in them. And you'll basically just build stronger bones. And so obviously if exercising builds bone, then not exercising will lead to less bone. And so, there's probably not a lot of you guys out there that are going to have to worry about this at some point, maybe more in the future. We'll see. But it turns out astronauts have a lot of bone problems, because when they go to space, they're not putting a lot of stress on the bone. And so the bone grows in response to like forces being kind of pushed on the bone and kind of like crunching it, not like crunching it, like breaking it, but just like compressing the bone overall causes the bones to grow thicker. And when you're in space, there's not a lot of forces acting on your bone. And so because you're just floating around, right, in zero gravity, which is awesome, but it's bad for your bone health. And so astronauts will often get osteolytic osteopenia, which basically means their bones are weaker and smaller and they just kind of degrade over time. And this is something that is actually kind of an issue for astronauts coming back to Earth, because if they go to space for a prolonged period, like on the International Space Station or something like that, if they go to Mars, right, for example, Mars also has weaker gravity. And so in theory, people who live on Mars, their bones would be weaker than the people who live on Earth. I think I was watching a TV show about this. I can't remember what it was. It's going to come to me at some point about people who live on Mars, people who live on Earth. Anytime anybody goes from Mars to Earth, they have trouble dealing with gravity because their bones are weaker because they just grew up. And I'm like, that's an awesome fact, because that would be true. But this idea of kind of dealing with this is something that NASA is super interested in, right? Because they really need to understand what's going on with this. And so most people think the scientists dealing with NASA, like physicists and engineers, but there's also a fair amount of physicians and people trying to understand this. And this leads to my fun fact of the day of just one of the weirdest jobs that exists. So every once in a while, NASA will want to do a study on this and do a study on kind of what happens to your bones when you don't stress them. And so what they will do, because it turns out it's really hard to just send a bunch of people to space to do a study on this, what they'll do is they will hire people to just lay in bed and not move. And that's the job. Your job is to go to NASA and then lay down and then do that for months. And so I know that NASA has done this for 6 months at a time. They've done it for 2 months at a time. I think the last time they did a study on this was in 2019, pre-COVID stuff, where they were just paying people basically $10,000 a month to just lie in bed. Now that sounds like a real easy job, right? Like there are days when I just want to lie in bed anyway, right? But it's so in order to kind of when you're in space, because there's no gravity, blood kind of goes to your head more than it does your feet. And so in order to study that, when you're lying in these beds for NASA, they tilt you. So you're just your head is slightly below your feet. And so your blood and all the fluids kind of like come towards your head, which is kind of mimicking what happens in space because gravity isn't pulling it down. And so you're lying with your head like slightly lower than your feet, and you have to stay there, right? Like it's not just like, a 9 to 5, like, no, you have to like maintain this. And so showering is done this way, eating, going to the bathroom, right? All of this stuff is done with your head below your feet. And so it's I think it's actually a much harder job than it sounds at first. But it's a real interesting job that like people get paid to just lay there and don't move. And like just kind of thinking about what that does to your body, like spending months without exercise, months without like having like those compressive forces acting on your bones means your bones are going to be weaker. Your muscles will have atrophied in this time. And so it's actually a pretty difficult job overall. But I think at first glance, it always seems like, oh, that's the easiest job. You get paid to just lie there, right? But no, it's actually a little bit more difficult than that, but super interesting.
Yeah, I'm set.
Yeah.
I don't want to go lay down, not be able to get up from bed for a couple of months. I might actually lose my marbles. You're gonna see the marbles come out of my head.
Yeah.
But
it's funny when I brought this up, Azaii was like, what do they do for bathroom? Do they like put in catheters? Like what is like, she's like, I'm out. No way am I doing that.
I mean, the chance of infection, if that's the way they're going about it, I'm good. But yeah, so there's, we've covered a lot today, and hopefully you have been convinced about the importance of the bones in the body and all of the intricate ways that they modulate, the processes going on in your body. Something that I found helpful when I was going through bones was actually to draw out a diagram and add what was affecting what, meaning, what hormones are affecting the bones, what they're doing, right? How the bone responds to different, for example, physical stressors. And for me, that was really helpful. And that's basically akin to like a study guide or a review sheet. And you've heard us talk about those before, how they can be really helpful for MCAT studying in general. And that way you have, a single sheet of paper that you can come back to and review. Something else that we didn't talk about or didn't go into in depth in today is the actual structure itself of the bone. And that's because you really got to see it to understand it. Mm-hmm. And so it's something that I strongly recommend you go back and take a look at when you go to study. And so make sure that you have an understanding of that. And that's also something that you can draw. You don't have to be an amazing artist to make study guides and study sheets for yourself. And so as always, we'll have topics, we'll have some of this on the AMC outline on the website. So you can head over, test yourself, see, what we describe on bones and the skeletal system. Take a look at that. You're always welcome to continue watching our podcasts. And there are so many resources on the Jack Westin website. And so we encourage you to go take a look at that. And if you have questions about applying or how you should approach studying, or if you should be testing at this point in time, or what other resources you might need in order to do well on the MCAT, set up a meeting with our academic advisors. Having a meeting with them is free, and they are fantastic human beings and fantastic resources to navigating the madness that is studying for the MCAT and applying to medical school.